Hi, Cassie.
Hi.
My name's Lizzie, and I'm going to teach you how to take care of your leg when you go home.
Perfect.
Are you ready to learn?
Yes, because I'm going home soon, so I
Good.
need to know this.
Perfect. So it's a good time?
Yes.
Okay. So we're going to talk about some goals that we have for you and how you can meet them.
Okay.
So the first goal is to avoid infection.
Okay.
So you don't want your leg to get infected, or we're going to have all sorts of other issues, and we don't want you to be readmitted to the hospital.
Okay. Me either.
The first thing that you can do is to wash your incision just with soap and water when you're in the shower.
Okay.
But we don't want you to put any lotion on it or anything like that.
Okay.
And then you can avoid touching it. Don't let other people touch your incisions. That can just put extra germs on it. And then make sure you keep your ACE bandages on at all times during the day.
Okay.
Okay?
But I can take them off to take a shower, right?
Yep.
Okay.
And you can just let the water run over your incision.
Okay.
Okay.
But can I soak my incision? Like, can I take a bath, or does it have to be a
No,
shower?
not until it's completely healed.
Okay. So
Okay.
just showers?
Just showers.
Okay. All right. So how do I know if I have an infection?
Good question. So some signs of infection is if your incision gets red more than normal, or it's warm to the touch.
Okay.
If you start to feel like feverish or like you have chills, that can be a sign of infection. Increased pain or drainage that looks like pus. You can call your provider if you have any of those symptoms.
Okay.
Okay?
All right, sounds good. So if it's red, if it's warm, and around my incision, and let's see, what else did you say? The drainage, if it looks pussy, and I need a call?
Yes.
And if I have a fever or chills?
Yes.
Okay.
And so you can call your physician for those, but there's a few things that if you come across them, then you have to call 911.
Okay.
And those are if you feel short of breath or chest pain, you should call 911.
Okay.
Okay? And then you can call your provider if your leg feels blue. If your leg looks kind of bluish or if it feels cold,
okay.
Then that could mean decrease in circulation.
Okay.
So you should call your provider right away.
Yeah.
Or if you're having calf pain that's red, because that could be a sign of a DVT.
What's a DVT?
A DVT is a blood clot in your leg.
Oh, okay.
So we want to prevent those.
Gotcha.
Okay? Which brings me to your second goal, which is participating in physical therapy.
Okay.
So you can do that, and that will help prevent blood clots because you don't want to be sitting still too long.
Okay.
So we want you to ambulate 3 to 5 times a day while you're at home.
3 to 5 times a day?
Yep.
What if it hurts too much, though? I'm
Good question.
Too much pain.
We'll get to that next.
Okay.
Okay. So next you're gonna go to physical therapy, and we have your first appointment scheduled for Wednesday at 3 p.m.
Okay.
Okay. And like I said, that's until you're completely healed, you'll go to physical therapy.
Okay.
And then they'll teach you things that you can do at home also.
Okay.
So you asked about pain. Your third goal is to control your pain enough that you can do your physical therapy.
Okay.
So you're going to take your scheduled pain medication, and hopefully you'll be able to take it before your pain occurs. So you don't want to let your pain get too out of control.
Okay.
So what's your pain goal?
I would say a 3.
Okay, so when you start to feel like 2 or like you're getting up there, you want to take your medicine right away.
Okay.
And then after that kicks in a little bit, then you can do your physical therapy.
Okay.
So you're going to go home on hydrocodone, which is Vicodin.
Okay.
Or you can have Tylenol, but there is Tylenol in hydrocodone.
Okay. So
So make sure you're not taking more than 3,000 milligrams a day.
Okay.
And some side effects are nausea, vomiting, and a big one is constipation. So you want to make sure you're eating enough fiber and drinking liquids too.
Okay.
Okay? And dizziness is another side effect.
Okay.
So we don't want you to fall again. So make sure that if you're dizzy, you stay sitting down for a while until that subsides.
Okay. So don't get up when I'm feeling dizzy?
Right.
Okay.
And then you asked about, in addition to the foods to avoid constipation, you want to eat enough protein because that can help your leg to heal too.
Okay.
Okay. So your fourth goal is to avoid additional injuries. Since you fell, you're a high risk for falls, and especially with your recent surgery.
And I don't want to fall again, so what can I do?
Okay. So you can avoid any ice when you're walking outside. Make sure you use your walker.
Okay.
And then you can make sure your house is neat and tidy with no rugs or cords.
Okay.
And keep it lit so you can see where you're walking.
Oh, good one.
Yeah. So do you have any questions or anything you need me to clarify?
think so.
Do you want to go over your goals one more time?
Yeah, let's do it one more time.
Okay.
Okay, so the first one is preventing infection.
Yep.
So I'm going to want to monitor my incision site. So if there's redness, any pussy looking drainage, if it's warm to the touch around that area, if I have the chills or a fever, I'll want to call the doctor.
Yep.
But if I have shortness of breath or chest pain, I'll want to call 911.
Good.
Okay. Let's see what else. I'll want to keep my incision clean and dry and only wash it with soap and water, no lotions. And let's see, I feel like I'm forgetting something. What am I forgetting?
Nope, I think that's good.
Okay. All right. Oh, and I have to have my wraps on at all times.
Yes.
Unless I'm in the shower.
Yep.
Okay.
1 second. We're almost done with our video. Sorry.
All right. And then my second goal that we have set is I am going to, let's see, ambulate or walk around 3 to 5 times a day.
Yep.
So for that, let's see, I'll want to make sure I'm using my walker correctly. And that kind of goes into my fourth goal of preventing further injury.
Yep.
So I'll have to make sure my house is well lit and remove any rugs or cords that will be in the way before I go home. And then I want to avoid slippery areas with ice so I don't fall again.
Good job.
Okay. And what was the other one? Oh, and taking my pain medication before I do any activity that could increase my pain. I don't want it to get too high and not be able to walk around.
All right.
All right. Did I miss anything?
I think you're good to go.
All right.
If you have any questions, you can always call the doctor's office.
Okay. Sounds good. Thank you.
All right. You're welcome.